Interview with Professor Greg Dore. The future of Hep C treatments. Can you explain the future of Hep C treatments and how they are different to the current options?
Okay, so the first message is that the future looks incredibly exciting in terms of new hepatitis C treatments, which is, I think, going to be amazingly empowering for people with hepatitis C and healthcare workers that are involved in care, because we're going to transform management of hepatitis C from an interferon-based era, which has been difficult treatment to get through, lots of side effects, suboptimal cure rates, into an era where we expect the cure rates to be around about 90%. With treatment that looks like it's going to be very well tolerated, very few if any side effects with these new treatments coming through in a much more simple to deliver and take form. So it'll be just tablets, no injections, and it may even be combination tablets. So you might have 2 or 3 drugs combined in one pill, for example, taken once a day. And the duration of treatment looks like it's going to be much shorter. So we think the vast majority of people will be treated for 12 weeks. Some people might even get by with 8 weeks of treatment only, and still maintaining those cure rates up around the 90% mark. So that's all the good news. The future looks amazingly bright.
How far in the future before we see these new treatments?
So we only have a regimen that's interferon-free at the moment, licensed in the United States, largely for genotype 2 and 3, although there is some indication for genotype 1. That's not quite at that 90% sort of level. It's the first sort of regimen coming through, but it's at least the first stage of moving into interferon-free therapy. Now, it's been licensed in the United States since late last year, so December 2013 it was licensed, and it's moving forward in terms of the process of evaluation through the Pharmaceutical Benefits Advisory Committee in Australia. Now, the previous new therapies that were included with interferon treatment, telaprevir and boceprevir, they took 2 years from licensing in the United States to listing on the Pharmaceutical Benefits Scheme. So if we follow that trajectory, then it won't be until late 2015 that we might have access to that regimen. And it's possible that that regimen still might be restricted to people with more serious advanced liver disease. So it may not be available to everyone in terms of underlying disease stage. I don't think there's going to be any restriction based on whether you're on methadone or buprenorphine or not, or whether you're still injecting or not. If there is going to be a restriction, it might be to those people with more serious underlying liver disease, but there might be a limitation on access initially. Hopefully beyond that, in the years following that we're going to get much better regimens with a 90% cure rate, and there's some clinical trial data that definitely suggests that's going to be the case, and that are going to cover genotype 1 and cover other genotypes. And eventually we think you'll have the same treatment that will be effective against all the genotypes. Yeah. What we would describe as sort of pan-genotypic, which would make things much simpler. But those sorts of strategies are still at least a few years away. But it's coming, and it's been promising to track the sort of evidence from the clinical trials.
Are there any known side effects with new treatments for Hep C?
And the first thing to say is we've been doing the clinical trials in Australia as well, so we're part of international networks in terms of clinical trials. So we've had some experience in terms of people going through the process with these new regimens. And the first thing to say is that most people who go into these treatments experience very few, if any, side effects, and many people actually feel better than before they started the treatment. And we think that's because by suppressing the virus with these new therapies, and the virus becomes suppressed very quickly, then you're removing the sort of direct effects of the virus on your body and the symptoms that may have been produced by the hepatitis C virus. So we find often that people have more energy, 4 or 6 weeks into a 12-week treatment course than they had before they started treatment. So that's incredibly exciting.
Should people wait till the new treatments become available? Or is it best to treat Hep C early?
Well, yes and no. So I think our current message is the message around disease staging. So to make an informed decision about whether to go into treatment now or to wait, it's really important to know how much underlying liver disease you have. Now, if you find out you don't have much liver disease, you can still access the current treatments and there's a reasonable chance of being cured, but you've got to experience those side effects that people generally have. But if you don't want to go into treatment now and you've got no significant underlying liver disease, you at least know that you've got years up your sleeve to wait until those new treatments come through, because generally hepatitis C, if it's going to progresses quite slowly. On the other hand, if you have your underlying liver disease staged and you find out you've really got serious underlying liver disease in terms of severe scarring or cirrhosis, then it's important to potentially consider the best available treatment now to try and eradicate the virus.